thank you. Thank you so much for having me. It's like I'm very excited to be here today to present this talk, Digital Technologies, Community-Based Interventions, and Maternal and Child Health in China. And this talk is based on a 5-year project we conducted in rural China, where we worked to address the evolving health needs of mothers and children during critical development stages. And in this project, we explored how digital technologies can help address implementation complications when designing these comprehensive and adaptive interventions to improve maternal and child health in these resource-limited settings. So I'm gonna share some of the key findings from this project. So first I want to give some background information. So there's substantial evidence on the critical importance of the first 1,000 days of a child's life. This period from conception to their second birthday, this window is crucial for a child's long-term health and development. So recognizing this, there is a growing advocacy for comprehensive and integrated intervention to help these families in navigating these many challenges they face during this critical period. So the WHO Nursing Care Framework for Early Childhood Development is one of such initiatives that supports integrated interventions incorporating these key areas such as health, nutrition, caregiving, safety, and early learning. But questions remains about how to optimally design, implement, and scale these integrated interventions. So far, there have been multiple integrated programs in resource-limited settings that have tested the feasibility of combining these multiple health initiatives to address these challenges, but they have also highlighted some common challenges, such as logistical complexities, constrained resources and budget, and the overwhelming workload for community health workers who are responsible for implementation. And these challenges can limit the effectiveness and scalability of these programs. So our team designed this program called Healthy Future Program, which is a comprehensive and adaptive community-based program aimed to meet the holistic and evolving needs of mothers and children from pregnancy through 18 months. And here I wanted to highlight it that this program features a comprehensive curriculum designs that covers 6 content domains advocated by the WHO Nursing Care, is also adaptive to different developmental stages, such as the information provided is both comprehensive and timely for families at different stages. And we also incorporated digital health technologies to reduce these logistical complexities to allow for adaptable, streamlined, adaptive implementation. So here I just want to introduce our study team, because this work is impossible without an amazing team. So I want to just acknowledge every team member of this Health Future study team, including Professor Sean Sylvia from the University of North Carolina at Chapel Hill, Professor Gary Damastat from the Stanford School of Medicine, Professor Ann Weber from the University of Nevada, Reno, and our community collaborators from Sichuan University, including Professor Huan Zhou and Professor Yujie Wu. And there are also a few colleagues from my center at Stanford, including Professor Scott Rozelle, Ms. Alexis Modena, and Ms. Ann Guo. So since this program was implemented in rural China, I also wanted to provide some contextual background. So you might have known that China has experienced significant progress in child survival over the decades, but poor health and malnutrition are still prevalent among these rural children in China, like many other resource-limited settings. And previous research have reviewed that many of these issues are largely preventable through increased caregiver knowledge. And at the same time, there is a growing concern regarding maternal mental health among mothers in rural China, largely due to a lack of accessible mental health services in these rural areas. And in light of these challenges, not only in China, but also in other resource-limited settings, so we designed this Healthy Future curriculum that covers 2 years of period from the second trimester of pregnancy to 18 months. It covers 6 content domains, including breastfeeding, complementary feeding, preventive health and daily care, maternal nutrition, caregiver mental health, and update government health services. And this figure just shows how this curriculum covers 6 content domains and spans this 2 years period from pregnancy 4 months until infancy 18 months. As you can see from this figure, the whole curriculum is designed to be adaptive to different stages, such that the information provided is both comprehensive and timely for family at different stages of pregnancy and infancy. And it also follows an interval structure, typically with 3 months each. So new content is usually introduced in the first month of each interval, followed by 2 months of content reinforcement and activities. So overall, this curriculum is just structured to address the dynamic needs of families during this critical window. Well, when we designed this curriculum, we knew that we wanted to ensure this accessibility to engage those families in hard-to-reach areas. So we designed this curriculum to deliver through monthly home visit by community health workers. The curriculum is highly scripted to facilitate delivery at home by a CHW who may have limited education or prior knowledge. But at the same time, these designs also requires the CHW to manage multiple families, all at different stages of pregnancy or infancy, which created significant logistical complexities. So how can we ensure that each family received right content at the right time? And how can we maintain this intervention fidelity when the design itself was relatively complex? So we tackled many of these challenges by designing an app. And this is the example of our Healthy Future app, which is designed to streamline this delivery process. And it includes 2 components, including a tablet-based application for CHW and a web-based administrative portal for supervisors. So this tablet-based app for CHW is built with rigorous algorithm aligned with curriculum design. By doing so, this stage-appropriate information are automatically assigned to each family at each visit. So essentially, it simplifies the task of the CHW, so they only need to schedule home visits and deliver the content. And it also enables record keeping and data collection. And this web-based administrative portal allows supervisors and researchers to remotely access this process data collected by the Healthy Future app. Well, this is where I want to give the demo, but yeah, I'm gonna do that at the end. Okay, so next, so I guess like given all of this data, the designs, the one important research question is, does the Healthy Future program truly improve family caregiving behavior, child health, and maternal mental health? So we designed a cluster randomized control trial in rural communities of China. So we focused on 119 rural townships from 4 poverty counties in Sichuan province of China. And we targeted those families with pregnant women and infants younger than 6 months. And we randomized 40 townships, 10 per county, to receive the Healthy Future intervention. Well, so here's our program timeline. So in 2018 to 2019, we formed the team and started to develop the Healthy Future curriculum. And starting March 2020, we started to develop the app. And starting May 2021, we began recruiting and training community health workers. And these community health workers were recruited from the local township health centers and were selected by the study team by interviews. And most of these CHWs were long-term female residents of their townships with at least a middle school education. And their training covered all the contents about the Healthy Future curriculum and how to use the Healthy Future app to deliver the content during home visit. And between June to August of 2021, we formed the enumerator team and conducted baseline survey across all study townships. And we collected household level data on these babies, caregivers, and families. And in August 2021, the intervention officially launched. These families from the 40 treatment townships were enrolled through a door-to-door approach. Our research team members accompanied the CHW to introduce the program and enrolled the family. And over the next 12 months, CHWs continued to conduct monthly home visits with these families with the help of the Healthy Future app. And in order to provide continued support to these CHWs, we also conducted monthly check-in meetings and 3 monthly in-person home visit observations to help CHW to address some challenges they had in the field. And as the program concluded in September 2022, we conducted another round of household survey to collect follow-up data and for program evaluation. So our data sources, as you could imagine, our data source, we have 3 data sources, including this household level data collected from the baseline and the follow-up survey. We also have CHW data collected from CHW surveys, and we also have tons of administrative record collected by the Healthy Future app, which recorded detailed information about each home visit, including the date and time of this home visit, the modules delivered, and the attendance of family members and family knowledge check. And in terms of the outcome, well, our primary outcomes only have three measures, including hemoglobin level, exclusive breastfeeding, and dietary diversity. But we also considered a wide range of secondary outcomes, considering the comprehensive coverage of our curriculum. And next, so here are just some results from our evaluation. So at baseline, we recruited 1,308 families, including 809 families with infants younger than 6 months and 499 families with pregnant women. And among these families, 88% of them were successfully followed. And treatment and control families were well balanced at baseline. And this table just shows some basic baseline statistics. And here I just want to highlight it here. So this among those babies who have been born at baseline, their anemia prevalence was pretty high. It's like 43.3%. And among these primary caregivers, most of them were mothers. They have showed a significant high level of mental health problem, such as this depression prevalence was about 20%, it's 19.5%, anxiety was 21.2%, and stress like 5%. So over this 12 months intervention period, we have completed a total of 5,026 home visits, with 82.6% of treatment family participating at least one home visit. And on average, each family received 10.8 home visits, and at most the family attended 16 home visits. And in terms of the modules, we considered breastfeeding modules were completed the most with 7.7 sessions. And these figures shows the number of home visits completed by month. So this just shows the benefit of having this Healthy Future app to collect this process data for us. So these data were readily available as long as these home visits were completed. And so overall, we have found this Healthy Future program led significant improvement across various health, behavior, and intermediate outcomes in rural communities of China. And this table just shows that this program has significantly improved their breastfeeding, complementary feeding, hygiene, and their caregiving knowledge and maternal mental health. And here are some selected results with some figures. And this is a caregiving knowledge. And this in this left figure, this blue line just represents the treatment family, and the right line just represents the control family. So you can see a clear shift of this blue line to the right, which indicates that the treatment family had a significant improvement in their caregiving knowledge. And this the right figure that shows that this improvement in caregiving knowledge are most likely to occur if they started early, especially during pregnancy. Well, we do not find significant effects on anemia, probably because this is a short-term evaluation. But at the same time, we find a significant improvement in terms of their breastfeeding practice and complementary feeding practice. And we do not find significant effects in infant growth and health, but we do find that if the treatment begins during pregnancy, this child growth improves significantly. And caregiver mental health have also significantly improved, which have showed the persistent effects no matter when they started. Well, overall, so through this talk, I just want to introduce this comprehensive and adaptive intervention we conducted in rural China, integrated with some digital health technologies to overcome implementation challenges. And this is just one approach we explored in China. Of course, more research is needed on optimal intervention designs, implementation strategies, and scalable solutions to address the many challenges they face during this critical window. So I want to say, like, many of the results are not published yet. We have our main evaluation paper under review right now. We also have a few other manuscripts under preparation. But if you are interested in this program, we do have our protocol paper published a few years ago. So this is the title, but well, you could also pay attention to our center's website. So as long as we have our publication available, we will post it here. Well, so these are our partners. So really big thanks to our partners. This overview. So here I really want to show the demo. So this is just a quick demo my colleagues at Stanford conducted a few years ago with our founders. So
Good evening. It's afternoon here when we're recording this. My name is Scott Roselle. I'm the director of the Rural Education Action Program that we've had long, really nice relationship with the YFP. And certainly Yvette has been a big supporter of us in the past, and we love Kenny and Eric. We're here today to do one thing, and I think you know a lot about the new Healthy Futures project, but what today we're going to do is sort of tell you a little more about a key component, and that's the app that's been produced to use and make the impact of this intervention sort of more consistent and deeper and really try to meet the needs of rural China. So I'm going to first introduce my colleague Alexis Medina, who's the project manager of the Healthy Futures project on the U.S. side. At least you've talked to Dr. Zhou, who's the PI on the China side, and then Anne Guo is going to give you the app. She's has been worked a lot of her last year's. A lot of lifetime in this last year has been spent on it. So, so Alexis, why don't you tell us a little bit about the use of the app in the context of Healthy Futures, and then we'll go right to a demonstration.
Definitely, yeah. So with the Healthy Futures app, so of course we're developing a curriculum that's used to teach health and to provide health and nutrition support to families. Unlike with some of our other works, for example, child stimulation, where it's kind of a fixed, all children at age 6 months should be at about the approximate same development stage. With health and nutrition, it's a little bit more nuanced. There are a lot of different paths that people can take. Some babies, they're breastfeeding, others are formula feeding, some are getting both. Or, some parents may have started introducing solids at age 4 months. Others might not have even introduced at age 12 months. And so when we were originally developing the curriculum, we were just finding that it's not clear what exactly at age, for example, 3 months, what content they should be having. Some parents will want the breastfeeding content. Other parents will want to be learning more about formula feeding. Some are going to want more on, complementary foods. And so that's when we started thinking about taking advantage of the digital format to really make the app adaptive. and responsive to each family's needs. So as Anne will show you, we have built into the system different tracks, and we have questions, sort of, are you doing X? And, if the answer is yes, then they go to sort of one track of information. If the answer is no, then it's another path and another set of information that's provided. And it's built up this way. I think the best way to sort of see this in action is to actually see it in action. So I'm going to hand it over to Anne, who can sort of show you in real life how it works.
Sure, I'd be happy to share more about the app itself. And as you can see on the screen right now, we're at the landing page, the home page of the Healthy Future app. And immediately you can see, as a user, you can see what's the next home visit and when will it be. So for instance, if I were a CHW with this app, it will be very easy for me to know when my next home visits will be and plan ahead of time. And I can also see on the second box, in the second box on this page, I can see the exact lessons and modules that I'll be delivering for this visit, just so I am prepared and aware of what I need to, if I need to refresh my knowledge on any of the content. And the second tab on this app is a list of babies that me as a CHW will be managing. So this list view allows me easy access to all of the babies, their primary caregivers, and how to contact them, all in one place. And I can see whether they're babies who are already born or if the mom is still in their pregnancy stage at one glance. So it's very convenient for me to keep track of all of the families that I'm managing. And the third tab here is home visit scheduling feature, which has a calendar view, and also it allows me to basically book future home visits. And I can see, as you can probably see here, any dates with a little dot underneath are the days that I have booked a home visits for. So it will be very easy for me to see which days do I need to go out and go to the families. And the last tab here is pretty simple. Personal Information Management Center is essentially just where I store my username and and password, and it's a very easy change in case I forgot my password. And the most, I guess, functional part is going to be the home visit scheduling, and as you see later, accessing all of the curriculum content all in one place. And as Alexa said, we have a lot of different tracks designed for different moms. And instead of using the paper-based curriculum to flip through and accidentally, we might accidentally land at a different or a wrong content that we didn't intend to give the moms. The app has already have the built-in features and loops in place so that the CHWs don't have to do any of those calculations or skips. They just simply follow what's next on the app. So as I'll show you here, we can take the example of the baby who's born for 1 week, and then we can take a look at the home visits information page that the CHW will be able to access. So the page shows me when exactly is a home visit, where does the family live, and what's the mom's phone number in case I want to call ahead of time to confirm our appointment. And the last box here shows all the modules that I'll be delivering. And on the upper right corner, there's a preview button, which I'll be clicking on right now. And it allows me to pre-access all of the modules before even starting the home visits. Because we sometimes have activities that require certain materials to be brought with a CHW. Sometimes it might be a baby doll that we use for demonstrating how to hold your baby while breastfeeding. And this preview function allows us to prepare for any of those kind of situations. So why don't we go ahead and try to take a look at, sorry to pause here, should I?
Okay, I guess I will pause here as well since we have limited time, but if we have any time left at the end, I would love to play all the remaining of this video. So I guess here it is. So I'm happy to answer any question you may have about this project.